she has done. So please join me in welcoming Saundra today.
Well, good morning, and I'm thrilled to be here. And I do also want to thank Marie and Tari for inviting me, and they were very, very persistent, which I thought was great and incredibly impressive, and they were really thrilled and excited about this today. And I also want to thank all of you for getting up on Saturday morning and coming and choosing to spend the day with us. So as you heard, my name is Saundra Pelletier, and I'm the Chief Executive of Women Care Global and of EvoFem. And Women Care Global is a nonprofit, but we're also a hybrid model. And why that really matters is that we really care that every woman, no matter who she is and no matter where she lives, will be able to decide when and if and how often she has children. And we're able to impact that through a sustainable supply chain. And I say that we focus on the unsexiness of the supply chain because it can be ever so boring at times, but it's also ever so critical. Because sustainable access to family planning and contraception is really the answer to sustainable change in every economy. And you know, what good is it to have access if you can't afford it? And what good is it to have access if you can't rely on the quality of it? And what good is it to have access if it's not sustainable access? And I'm going to talk a lot more about that when we talk about leadership in public health. And as you also heard, I'm the CEO of EvoFem, which is an interesting transition that happened. And it's truly a marriage, an arranged marriage of sorts, of a public-private partnership. And I really believe that that's going to be the ongoing answer to sustainable change. Both organizations looked at ourselves and said, where are our vulnerabilities? And let's try to not create core competencies that we don't have. Let's try to partner and marry with another organization so we can have the biggest impact. So EvoFem develops innovative products. We have the supply chain in order to take those products into the hands of the women that need them most. And then together, we really feel like we're going to be able to continue to make a much bigger impact than we could have alone. So I did want to also just take a moment and step back and tell you a little bit about how it is that I got the wonderful privilege of being here today and leading these two organizations. I actually started out in Maine, in a town called Caribou, Maine, the northernmost city in the U.S., the furthest point that you travel to from where I live now in San Diego, if that tells you how much I thought I fit in Caribou, Maine. My mother's like, what happened to you? People think that we did bad things. I'm like, well, if the shoe fits, no. So in Caribou, Maine, though, very, very rural, girls, it was really assumed they had two choices, who they married and how many children they were going to have. And that was just about it. My mom grew up in a farming family with over 10 brothers and sisters and chickens and cows and sheep and all the amenities like outdoor plumbing. And so she really felt that cooking and cleaning and domestic things were never going to get me out of Caribou, so she taught me none of those things. Don't come to my house for dinner. You will definitely be hungry. But she really cared passionately about really focusing on trying to fight against society norms. I did things like take arc welding and took fly tying instead of cooking and sewing. Not because I wanted to fly fish, nor did I want to become a welder, but I wanted to prove that girls could do that. And I wanted to prove that I could do that. But as I continued to do that and sort of fight against norms, I also recognized pretty early on that I was doing it in a safe environment. What was really going to happen to me? I was going to get a talking to, maybe I might get in a little bit of trouble, but nothing really profound was going to happen. And when we look at the work that we do in these developing markets, as a lot of you know, when women want to fight against the societal norms, sometimes they take their lives into their own hands, literally take their lives into their own hands. And we see women that are willing to risk their life, not to have another unwanted baby. We see women that walk a day pregnant with a baby on their back and a baby on their side, and they stand in line and they wait for contraception because they don't want to have 6 and 7 children. They wait for contraception because they want a quality of life for the children that they have. They want education for those children. Women, they want contraception because they want to work. They do. And so the exciting part about being able to run EvoFem is that they have 2 products, very different products. One is feminine hygiene. And at first, a lot of eyebrows raised, like, why do you care about a reusable menstrual cup? Well, we don't have the same luxuries, obviously, when you're in the developing world as you do here. We can go to any pharmacy and have 40 choices. It's a little overwhelming, but when you're in a developing market and you start your period and have your menses, maybe you're using a rag that you reuse. And if you don't have that option, you drop out of school and you drop out of work. So Reusable Menstrual Cup is a dignity campaign that we're launching. And for every cup that you buy in the US, we're donating cups in an effort to keep women at work and keep girls in school. And they also have an innovative product that's not yet launched called Amphora. Because if you're sitting in a developing world and you take a product and you have a side effect, and one, if you're brave enough to even get it, and then you have the courage to take it, which is usually against a religious belief system, and if your husband finds out, you're going to be probably badly beaten. If you do all of those things and then you have a side effect and you have no education and you can't read and you can't write, it's very, very scary. And you think, oh my goodness, I'm being punished. And so we're launching a product called Amphora. It's hormone-free, it's woman-controlled, it's pericoital. So when women cannot win the negotiation about condom use in the markets where we work, they don't have to worry about that as much. So we're really excited. So it's wonderful that a small nonprofit called Women Care Global has access to these amazing products. And the reason that we do is because our ability to really say we need to care about social good. And even though, yes, you have your shareholders, Evofem, that you have to care about, it doesn't just feel good and look good and sound good. Your shareholders will probably respond very positively that you care a little bit about social good. And they said, we agree. So it's been a really, really nice opportunity. But going back to sort of my long and winding road to get here, when I started out my first career, it was in private sector pharmaceuticals, and it was working for a company that launched the first birth control pill, GD Searle, and that was called Enovid. And I actually thought I was going to be a broadcast journalist. I wanted to be Connie Chung. She was more popular back then. And when the interviews came, the pharmaceutical companies that came to interview said, you know, it's going to be really tough for you to get a break. And, you know, we have this great package. And while you're interviewing for these other jobs, you could be promoting women's health to OBGYNs. And it's so empowering. And you get a company car and you get a bonus. And I'm like, okay, that sounds pretty good. I'm going to do that. And 20 years later, I was in women's health. And I had the opportunity to work on a global franchise for women. And the things that I learned were incredibly shocking. And a lot of the things that I learned, we did a lot of quantitative and qualitative market research on women from puberty through menopause. And we really tried to answer Sigmund Freud's question, what do women want? And I became very popular with my male friends. They're like, just tell us anything, just throw us a bone. We have no idea, you know. And what was really interesting is that women held in, no matter where they lived and no matter what their socioeconomic status, they cared passionately about the quality of life for their children. They cared that they were able to choose. They wanted control over their own bodies. But the interesting thing that was a little shocking too is that even when we said to women, cardiovascular disease is the #1 killer of women, like, yeah, we hear that, but we don't necessarily care about that. Like, okay, well, should we talk about breast cancer? Yeah, not so much. And the interesting thing that we learned too is women cared about aging and they cared about loss of libido. And when we really peeled back the onion, it wasn't that they cared that they looked any worse or even that they cared that they had less of a sex drive. They cared about how was that going to impact their relationship with their partner. Were they going to have a different relationship with their partner as a result of their own changes? And that made me really angry and really frustrated. And I thought, how could this possibly be? We need to be more selfish. We have to focus on things that, you know, our own health. Why is everything about others? And it was a really big aha moment for me because I really tried to spend a lot of time thinking about the martyr mentality and pleasers. And do women take the right kinds of calculated risks? And certainly to move their careers forward. And I had 3 really valuable lessons as I tried to maneuver my way up the corporate ranks. And the first lesson was calculated risk, that encouraging women that it's okay to do it. Not reckless risk, but risk that involves making changes and traveling to places and contorting and doing things that might be a little unpopular and might not be conservative and might not seem well organized, but really jumping at opportunities as frequently as absolutely possible so that you can well round your career, so that you can say you've done a variety of different things. Forgetting about labels, because, it may not feel good that your title is assistant. In my opinion, that's a huge mistake. It's very, very important to get as many experiences as you possibly can. So risk, I thought, was something that more men easily did. The second thing was self-promotion. When I talk about self-promotion to women, they're like, that just doesn't feel good. It just doesn't resonate with me. And I want to promise you that I think that is one of the most critical keys to success. You don't have to do it in a boastful way. You don't have to put on a peacock feathers and stand around and sing your own praises at the top of your lungs. But if you don't self-promote, others are not going to promote for you. And they're not going to promote you. Self-promotion can be very subtle, but it has to be very purposeful. You need to make sure you're letting people know what you're doing and what you're contributing. But most important, you need to let people know what you want. And not in a diva way, but in a way that people know that you have a trajectory and a purpose that you want to get to, that this is the piece of public health that you care about, and that you're going to find a way to get there. And as long as you hold that intention, I can remember being in jobs, and I can remember disliking my boss, not liking a policy, not liking a rule. And the first thing I thought was, I am going to get myself promoted so I'm the boss and I'm the decision maker so I can change that archaic, ridiculous rule. The very first day I went to sales training, there was a whole room of people. There were 50 brand new sales reps, and I came wearing what I thought was the smartest looking pantsuit that I ever could possibly find in Maine. And they said, we need to see you in the hallway. We're going to have you go back to the hotel because women are not allowed to wear pants. Ladies don't wear pants in business. And I thought to myself, oh my God, I am absolutely going to become the boss and fire all those people who set that rule. So ridiculous. My pantsuit's so much nicer than half these dresses. And I was shocked. And I took it, of course. And I apologized. And oh my goodness, what was I thinking? Clearly my raising in Caribou, Maine. Oh my God. But it was really shocking. And then I can remember when I was a sales rep on our team and I was the only girl, and my manager said to me, you need to come to the meeting a day early so you can plan it and put up balloons and put everybody's name tag, and it's this person's birthday and we need you to get a cake. And I said, why do I have to do that? And he said, well, because you're the girl. And I thought, I'm so going to fire you when I become your boss. No, I'm half kidding about that, only half. But I really can remember being just appalled. So I decided that there were women that I admired, and I just thought they did such an amazing job. And I wanted to do things that I could, to emulate them. So I started keeping 2 journals. And this is going to sound, I'm being very transparent with you today. I'm purposely not looking at Jennifer, who works with us, because she's going to be like, why would you say that in this talk? I kept 2 journals. One was all the things that I hate. I actually used that word. I did. I know. You're supposed to say I dislike at a heightened level. But all the things that I hate and all the things that I love, because I didn't want to forget. Because I met a lot of women that spent so much time clawing their way to the top, and they were so damn tired by the time they got there, they couldn't imagine helping someone else build a platform for success. And I thought, I'm not going to do that. I'm going to remember everything that I think should be different and everything that I admire that's good. And I kept this journal, and it actually made me feel a lot better, by the way, that I was keeping notes of all these things that I had to remember. And it really did, when I would see other people talk about what they had accomplished, I would think to myself, well, I did that too, or I did something that I thought was even better, but nobody knew because I didn't tell anybody. I thought they were going to discover it on their own. Isn't that the way the world works? And so I recognized, though, pretty early on that you have to be your own biggest promoter. So that was the second thing. And the third thing that I recognized was that emotional intelligence was just underrated. Daniel Goleman's book is an old book. It's still one of my favorite books. And it talks all about the natural ability, I think, that women have. It's about your intuition and your instinct and reading situations and recognizing when to push and when to hold back. And that creating personal relationships with people is such a significant difference maker. And women think, well, we don't want to do that because, we're emotionally centered anyway, and we don't want to act like we really care about somebody. We have to be, very serious, right? We have to not emote. And I want to suggest to you today, I think it's a terrible mistake. Because the personal relationships and the bridges that I've been able to build, now I don't mean over the top. You don't have to knit people's sweaters, unless you know how to knit, and you can make nice sweaters. But I'm talking about really communicating with people on a level that's a little different, recognizing that they've had a bad day, thinking about what it is they care about, noticing that they're obsessed with black Labradors. All this might sound simple and basic to you, but when you can connect with people on their level about something that they care about, people do things for people, right? We stay at organizations and we leave organizations because of people. But building trust and creating loyalty, you cannot imagine how it helps throughout your career. Our organization just had this very significant opportunity to put a brand in our portfolio. And 15 years ago, I actually didn't even really recall this story, but 15 years ago, I evidently was at a conference, and this woman was having a really bad day. And she dropped her bag, and everything fell out, and she was a speaker, and all these different things that had happened, and I saw her in the hallway and said, I don't want to overstate this because I don't want to really focus on the fact that you seem to be having a bad day, but you do, and if there's anything that I can do, I would love to help you. And she asked me 2 different things that she really needed, and I spent like a whole hour of the conference, and all my colleagues were like, what are you doing? You have to sit in this conference. She was one of the decision makers 15 years later, and I say that because as women, we do really have this different ability to connect. There's a book called The Female Brain, and it talks about the part of the brain that controls memory and emotion, and it is twice as large in women as men. It's true. It's why men sometimes think we're witches and Salem. No, and it is true that the part of the brain that controls instinct is larger in men. But I guess I just want to encourage you when you look at your careers and what you want, and as you look at what you want today and what you might want going forward, that forgetting about the labels is very, very important. And even if for some reason a label might seem derogatory to you today, it doesn't make any difference. It's the contributions that you're going to make in that role. Take the risk to do it. And then when you're there, really purposely try to figure out how you can connect to a variety of different people, not just the people above you, the people next to you and the people below you, because it will really make such a significant difference in your career. So I'd like to sort of transition just a little bit to kind of get back to continuing on the trajectory. So when you think about women and you think about, you're here because you believe in public health, right? So I'm sort of preaching to the choir today, which excites me a lot in a very big way. Sometimes I'm in audiences where people say, you're still talking about contraception. You have to be kidding me. Isn't that solved? Oh my God, it's so boring. We have to care about nutrition and microcredit, and we have to care about, sustainable gardening. And I always find a way to say everything that you care about will be better served if women have access to choice, if they have the dignity to control their family size. Sometimes that falls on deaf ears, but I do really believe that, very, very passionately, that, it's all about choice, not chance. So kind of shake yourself off a little bit. You don't have to close your eyes unless you want to, but imagine that you are a young woman and you are in a rural village in Africa, and you're in traditional dress, and you can't read, and you can't write, and you are far too young to have 3 children under the age of 5. And that by some wonderful blessing, you learn about contraception, and maybe it's from a market woman. And you decide that you want some of that it's really going to make a difference to the quality of life of the family that you have. And then you find a way to get to a clinic. You find a way to get there. And when you get there, there's no supply. Or when you get there, there is supply, but it's sugar pills. Because the organizations, though they do good and they're well-intended, they don't have the expertise or the capability to vet the quality supply. Or if you get there and the supply is good and you get access to it, but when you go back the next time, it's out of stock. So leadership in public health for me is about sustainable supply of commodities for women. Women are the healthcare decision makers, as you know. They decide for themselves, they decide for their children, they decide for their parents, they decide for their husband's parents. And at the morning, noon, and night, using private sector practice to vet sustainable supply, to me, is the difference maker, why I care about public health so passionately. So our organization, there are lots of great organizations that do great work, but there are 3 value propositions that I feel really matter in public health. And the first is really vetting not only supply and raw materials, but packaging. Heat degradation is a very big issue in the markets where we work. So it's really about taking the thoughtful time and investing the money and the resources to do the kinds of inspections that are needed so that when products get into a market, they're there to stay and that they're quality products. And in the process of doing that, they're affordable products because we use all the private sector expertise that we have to negotiate contracts where we can bring products in at scale. The other thing that I think is really important, and I had an interesting conversation with a lovely young lady from Bar Harbor, that is really making sure good business practice isn't something that seems unnecessary in public health. There's a lot of great nonprofits that are heavily subsidized because they have to be. That's okay, but that's not sustainable. And it might be sustainable today, but the future is about what are the ways that you can create a sustainable organization. Our way is to generate our own product revenue in more developed markets, modest revenue. So we go into places like Turkey and Mexico City and Puerto Rico, and we generate a modest profit that we use so that we can operate at a loss on purpose in places like Ghana and Kenya and South Africa. In some markets, we create a whole new middle class, like in Latin America, where a private sector company is selling a product for $100 and the public sector is getting it for free. Well, there's a whole demographic of women that are being underserved. And so we're creating a whole new middle class at a price that's $15. Now, we're still making a profit of $2, but we use that then to go to places where we operate at a loss. That's our specific model. But there are lots of ways as you build your careers and as you align with organizations and as you give your time and your attention and your hearts to these organizations that being thoughtful about helping them create ways that they can be sustainable. And maybe it's through partnerships, but I really believe that that's a significant difference maker. And that's a big difference maker that we have found in our markets. And when you look at healthcare reform, I know that you're going to hear a lot about that today, but you know, we think about these women that we're serving in all of our markets, and it's also my invisible sort of soapbox is, how about us? I mean, are we really doing enough to protect the rights that we have? It's taken an act of Congress for pregnancy to no longer be a pre-existing condition. I mean, seriously, right? And when you look at what's happening now, I mean, so gender rating is women and men get the same service and women pay more. Well, that's no longer going to be allowed. Thank goodness, since we still don't make the same amount. I actually had a very interesting argument a couple of days ago with this very smart woman who's like, you know, I heard you say that women still make 77 cents to the dollar of a man, and I'm very mad at you for saying that because you're not looking at, you know, they're looking at people that are doing the lowest level of labor, and there's nothing to compare that to with men. And I said, I can't really hear you. I'm sorry, what? But when you really look at what's happening in healthcare reform, I mean, still, right, we can now choose our own OBGYN without a referral. Woohoo! Right on. So it's just, I'm thrilled that everybody here cares so much about public health, you know, and there's so much work that we still have to do. But there's also a lot of work that we still have to do here. You know, there are some very scary, as you know, situations in the United States of America and these remote places where things happen to young women that we need to have a more enhanced focus on, right? And you know it, and I know it, but it's really, really important that we're so purposeful about it and that we continue to look at that and focus on it. And if you're going to make change, global change, you know, it starts at home, right? And it carries all the way through. So I also wanted to really think, I asked a lot of questions to Tari, mostly about, you know, what are the most important things that you think the audience will care about? And she told me like 400 things that she thought you would all care about. And I'm like, wow, are we going to do a sleepover? It's going to be great. No. She was actually wonderful, really, really, really great. But Alfred Summer has this book about the 10 lessons in public health. And it's great. And you should pick it up if you haven't. And he talks about the fact that it really is our responsibility to look at other human beings and go to the places where the problems are. Go to the places where the problems are, because it will forever change you. And my first trip to Africa forever changed me. The one thing that I joked about today is that because I came from a meager beginning and my grandparents had outdoor plumbing, I wasn't actually as shocked as most people thought. Because I lived in California, they thought, oh, and I have blonde hair, maybe I must be a Malibu Barbie. And oh my God, I've never really been in a developed market, outside of my Malibu Corvette car. And it was very interesting to be really unaffected by that, completely unaffected by that, but really affected by the risk that women would take, the risk that they would take to not have another unwanted child. They would do anything. Absolutely anything. And that's the thing that stuck with me. That's the reason why I also decided, when I get the chance, that I am going to learn everything that I can possibly learn on every division that I can learn, sales and marketing and business and finance and business development, and really understand women and understand policy and understand public and private health, so that someday I can do the boring things like make sure that supply is sustainable. And that when the stamp of authorship of our company is put on a product, people know that they can rely on it forever, sustainably. And so for me, that's about leadership in public health. But for me, it's also about really encouraging women to really stand up for themselves in a way that makes you uncomfortable. And maybe everybody in this room has no problems with the uncomfortableness of self-promotion, and I would be thrilled if that was true. That would be fantastic. And if it isn't true, I just want to really encourage you, because it's really been a difference maker. And the women that I've advised that to, and they've actually taken the advice, 100% of the time they've come back and said that it was good advice, that the risk that they took and the promotion that they did helped them get to a place where they can impact others. Because at the end of the day, let's be honest, right? If you teach a man to fish, he will probably feed his family, but if you teach a woman, she'll feed her whole village, right? She might go without food if she thinks someone else deserves it more than her. So it is really important to escalate ourselves to positions of influence and power so that we can make the kind of difference that we know is so important. So with that, I want to thank you for your time and for your attention, and I would love to answer any questions that you might have.